www.healthcmi.com, Acupuncture Continuing Education Online. Today, Acupuncture Severe Pneumonia Relief Findings. So if you click on News when visiting healthcmi.com, the news is at the top of the page. You can simply click on that link. You'll see this article in the news department, Acupuncture Severe Pneumonia Relief Findings, originally published May 4th, 2020 at healthcmi.com. Acupuncture is effective for the alleviation of severe pneumonia. Across 2 independent studies, researchers made significant, important findings. Acupuncture reduced clinical symptom presentations, shortened mechanical ventilation times, reduced the need for antibiotics, and improved gastrointestinal functions in severe pneumonia patients. So they're not looking at light pneumonia here. They're taking the most serious patients. One group received acupuncture plus an enema of Da Chengqi Tang, the herbal formula. Another group in a separate independent investigation just received acupuncture, and that was CV10 Sha Wan, stomach 25 Tian Shu, CV4 Guan Yuan, and stomach 36. In the first group, it was simply stomach 36 Zhu San Li, along with the herbal enema. So you had 2 separate, completely independent investigations, both finding acupuncture or acupuncture with herbs effective for the treatment of pneumonia. And what they did in the second study is they found that if you had drug monotherapy, you had decent outcomes. But if you added the acupuncture, just acupuncture, this was the one without the herbs, to therapy, then you did a lot better. In fact, the drug therapy produced a 78.6% total effective rate, but when you added acupuncture, it jumped up to 93.1%. And we do expect that. Naturally, I would like to see some other types of points added for severe pneumonia or more customization, because if it's severe coughing, you may want to add Ding Chuan on the back, things like that. You know, it really depends. This is such a serious topic because it can be life-threatening that we do need to customize. Now, for the purpose of a semi-protocolized study or a protocolized study, they tend to pick one set of acupuncture points for everybody. So they're trying to kind of stabilize digestion and overall energy levels in patients. However, some antitoxin properties might be appropriate with a large intestine 11 or a GV20 Dazoi. Other types of customizations may be necessary or appropriate. But again, for the purposes of a study, they tend to pick one set of points and give it to everyone. So studies are arranged in different ways. Some allow just a massive sample size, and everyone can do a custom diagnosis and a custom treatment. And then we just look at the overall efficaciousness of acupuncture. This study, like many, tests the efficacy of a specific set of points or a specific set of herbs, things like that. So that's what they did. But they got good results. I'm not surprised, having been working in acupuncture clinics for 30 years, it is my personal experience and the experience of most acupuncturists that I have ever met that we can significantly improve outcomes for patients with pneumonia and severe pneumonia or prevent pneumonia. So sometimes, whether it's an antiviral medication and fluids or an antibiotic for bacterial infections, for example, results can be limited. Results can also be limited with acupuncture and herbs, but when you really give the patient the extra benefit of acupuncture and herbs, it can profoundly change the course of the illness such that it is shorter or less severe, less intense. So we're looking for things like frequency, intensity, and duration. You know, can we reduce coughing attacks? Maybe then we can get someone to sleep at night a little better. Can we take down the fever? Can we dissolve the toxic phlegm in the lungs? These are the kinds of things we're looking for. Now, what most people don't realize when you're doing internal, like drinking Chinese herb teas, there are entire categories for each desired result. For example, if there's toxic phlegm, there are different categories that dissolve or eliminate different types of phlegm in the chest, deeper in the lungs, or in the upper respiratory areas, in the sinus cavities. We have herbs specifically that target specific areas. So this is very similar to the way drug therapy is working today to target specific areas. Chinese medicine has long targeted specific areas with different herbs. Likewise, we have different categories to clear toxins. So we have a clear, heat, dry, damp. We have a clear heat and toxin category, even chi level heat for high fever. There's actually a variety of, and when it goes deeper, cool the blood. There's different categories for different types of toxins. So we can prevent things like sepsis. And there is a lot of investigations out there, including those in the Health CMI newsroom, that clearly show that acupuncture prevents sepsis. That's also hugely important. So take a look at this article. Go to healthcmi.com, take a look, click on news, and look for the article entitled Acupuncture Severe Pneumonia Relief Findings. Thank you for listening. I'm Adam White, licensed acupuncturist for the Healthcare Medicine Institute. Thank you for listening. www.healthcmi.com